The Portfolio Committee on Health is going ahead with the National Health Insurance Bill, and that's despite concerns from various stakeholders. The bill aims to create universal health care for all South Africans. So what exactly does it entail, and how will it impact the healthcare industry for both individuals and for medical aid schemes? Let's unpack the NHI bill this morning with legal expert Anton van Dalsen, who joins us via our video link this morning. Anton, thanks for coming on. Would you mind, could we do an NHI for Dummies discussion this morning? Because, you know, the article that you wrote starts it off exactly right, that it sounds amazing, right? The establishment of universal health coverage, and it is so sorely needed in our country. But does it end up being that?
Yes, let me give you a quick overview. I think the issue is really that the government is trying to implement a system where they would pay for all health services, whether it's private or public, and they want to create a central paying point, and this is the central thing of the NHI. In doing so, they would offer effectively free medical aid or medical services to the population up to a certain point. In doing so, they have said in the NHI bill that they will prohibit private medical aid schemes from operating unless those medical aid schemes offer services that are not covered by the NHI. Now, the problem that I and many others have with this scheme is that if you look at the public health sector, we all know it is not working as it should. I don't think I need to come with all kinds of background information there. This is common knowledge. And secondly, the private health sector. The Health Market Inquiry of 2019 found that the Department of Health has been unable to regulate it. And what that means in plain speak is that it is far too expensive. So what government is now trying to do is to latch a payment scheme onto these malfunctioning two elements, both the public and the private, and to go on from there. And I think from my perspective and many others, the logical starting point would have been, first of all, to improve the public health service, and secondly, to regulate the private health service as it should. So what is effectively happening, a payment system is being latched over or onto the two malfunctioning elements of the health system. So I hope that gives you a very brief overview.
Yeah, it does help. Another big issue, and just in reading up in preparation for our discussion this morning, I've gone quite far back insofar as the coverage on NHI is concerned. I've got an article here from 2011 that talks about the health minister then, Dr. Arun Motsoaledi, and what he said about what it would take to make NHI work. And one of those things is that he said government hospitals need to be drastically improved. In fact, he said they need to be overhauled and there needs to be massive infrastructure development. That was in 2011. 2023, how far have we come?
I don't think that's improved. If I can just give you one example, the Office of Health Standards Compliance, which is a government-controlled office which investigates and goes into public health institutions, and it hasn't issued many reports in the last 2 or 3 years because of COVID. But in its last report of 2019-2020, it went into 647 health establishments in the primary health sector in 8 provinces, and it found that only 15% of them, 15% of them were compliant. So this is what you are dealing with. And my perspective is that government is closing its eyes to this aspect and just wants to push forward with the NHI, because in public it sounds good from a political platform, but when people don't know the background and they don't know how the whole health system operates, it sounds very good. Yep. But as soon as you start scratching around, you see that things are not good at all.
So, Anton, what would, I mean, if, let's say, NHI came into play in the current state that the healthcare sector is in? You know, what might be the result of that? With all of its challenges, with the shortage of doctors and nurses, the infrastructure challenges, doctors don't even have electricity half the time to do what they need to do. How would that work?
Well, let me give you a slightly cynical comment, and that is that before NHI, if it's, let's say, a before and after, before NHI, in the public health sector, you would get bad service and you would have to pay a moderate fee. Under NHI, you would get that bad service free. So I think that more or less, you know, summarizes the situation. And as far as the private health sector is concerned, the NHI bill prohibits private medical schemes from operating unless they cover things that are not covered by the NHI. And we can see if the NHI bill does go through Parliament finally, and it's not going to do so in a hurry. It will take, the parliamentary process will require another, I don't know, another year or so. Mm-hmm. But even if it does go through there, you can assume that there will be a number of constitutional challenges to this prohibition of private medical schemes. And I do not, quite honestly, I do not see this the Constitutional Court accepting this provision prohibiting private medical schemes as being in conformance with the Constitution. Is
that something that's changed over the years insofar as the contents of the bill? Because my understanding was that those who wanted to stick with private medical aid schemes could do that, but they would need to pay a tax over and above their medical aid payments.
Yeah. So the funding mechanism for the NHI would be the tax receipts going through SARS. So the argument would be if the population pays its tax, which funds the NHI, why can't they use if they have money available and they want to join a private medical scheme outside of that, why can't they do that? And I think the thing is that is really worrying is that in this prohibition of private medical schemes, the government has offered no justification that makes any sense at all.
I imagine this is going to lead to litigation from the part of private medical aid schemes as well.
I would assume so. They've been quite reticent in what they've said in public, but I think you can assume that, yes.
Yeah. So what are the kinds of figures we're dealing with now insofar as what's needed for NHI? Again, this article from 2011 talks about 125 billion rand that would have been needed in 2012, up to 214 billion rand that would have been needed in 2020. Do we have clarity on what the latest numbers would be?
One of the problems of the NHI is that there has been no feasibility study done. Mm-hmm. And nobody knows how much it will cost. And obviously it also depends on up to what level do they cover medical services. I don't think they'll ever be able to cover 100%. But there's no forecast as to what the costs would be depending on what level of cover they establish. So, you know, I think the comment can be made that the Department of Health is flying blind. And there is no, with the absence of a feasibility study, they are making it up as they go along. Yeah. And I think the problem is, and National Treasury has said this in so many words, that there is no money for this at the moment. But it's not clear whether this message has been received by the Department of Health. And the thing is, it's not just a question of money. You can't just throw money at the problem. Yeah. And if you look at international medical schemes, the state assistance in the USA is by far the most expensive of all developed countries, but it comes last when it's analyzed for quality. So throwing money is not the solution. And I think the issue really, one of the major issues is that there's no proper governance in the Department of Health and government hospitals. And I will just read you one or two sentences from the Auditor General's report which is you can find in the Department of Health's latest annual report. And the Auditor General says, I was unable to obtain sufficient appropriate audit evidence that disciplinary steps were taken against officials who had incurred irregular as well as fruitless and wasteful expenditure. This is now talking about the Department of Health. This was because investigations into such expenditure were not performed, full stop. So, you don't need any further comment on that. And that is a major issue, that there is no accountability. And it's not just the Department of Health. This goes into other government departments as well. It
would be like putting a Band-Aid on a gaping wound, I think would be an appropriate analogy. Anton van Dalsen, let me thank you for your time this morning, a legal expert, giving us some sense there of the NHI bill, which was pushed through by the Portfolio Committee on Health in Parliament just this week.